Hey everybody on YouTube. Today I am going to be going over the plastic surgeries for you to avoid. These are the worst cosmetic procedures because of one reason or another, and I'll be explaining them to you today. I'm also going to be answering your questions live. If you have any questions, feel free to share them with me. All right, so let's start by talking about some of the cosmetic procedures that I do recommend that you avoid. The first one is buttock implants. So one of the most popular cosmetic procedures today is buttock enhancement, and this is actually one of the fastest growing cosmetic procedures that we have. So why am I against buttock implants? Well, when you think about it, what is a buttock implant? A buttock implant is a solid silicone implant that is put into the buttocks, typically either above or under the large muscles of the buttocks. And this procedure is something that is not done all that commonly. It's actually usually done in women who are fairly thin, and because of that, Brazilian butt lifts or fat grafting to the buttocks are not an option for them. And the reason why I'm against this surgery, and I recommend that you avoid this operation, is because this area is actually the dirtiest area. I'm like trying to think of how do I best say it. It's the dirtiest part of the body. And so because of that, this has a very high risk of infection. And the thought of having two large gluteal implants in your butt getting infected, that's a pretty scary situation. And so that's the reason why buttock implants, the first reason why they are a surgery that I do recommend, a plastic surgery that you avoid. The other thing is, how do they feel in your butt? Well, one of my favorite TV shows of all time is Seinfeld. And you may remember the episode where George Costanza had his wallet, this massive overfilled wallet. Well, I remember watching that and thinking, wow, how would it feel like to sit on that wallet on one side of your butt if it was in your back pocket? And I know you probably know guys who have wallets that are huge that they basically do that with. Well, now think about how that would be if you had one in each buttock cheek, basically, that you sit on every day for the rest of your life. How would that feel? Not so great. And so that's something that I recommend that you avoid are buttock implants for that reason. Well, what about the Brazilian butt lift? The Brazilian butt lift is a very popular operation. This is something that you see on Snapchat, on Instagram. Plastic surgeons are performing this all of the time. This is a surgery where you basically take fat from your hips or your thighs or your abdomen. You purify the fat and then inject that fat into the buttocks. Why am I against it? I've actually performed this operation many, many times. But the reason why I'm against this operation is that recent studies have shown, and recent surveys have shown, that the BBL operation, Brazilian butt lift, fat grafting to the buttocks, has the highest mortality rate in all of plastic surgery. So let me repeat that. The Brazilian butt lift has the highest mortality rate in all of plastic surgery. There was a recent survey that found 1 in 3,000 patients who underwent this operation in the hands of true board-certified plastic surgeons died from this operation. Okay, so a mortality rate of 1 in 3,000. And that is compared to studies that have looked at the mortality rate in all of cosmetic surgery, which is about 1 in 50,000. So when you think about that, 1 in 50,000 people who undergo, in general, cosmetic surgery die from the operation. 1 in 3,000 people who undergo the Brazilian butt lift, fat grafting to the buttocks, die. And when you think about who's undergoing this operation, these aren't older people who have health issues. These are young people, quite often young people of color, young women of color, who maybe idolize certain celebrities like Kim Kardashian, Nicki Minaj, other celebrities with large rear ends, and they go see a plastic surgeon and have this done, and they never wake up after the operation. So why the Brazilian butt lift is the most dangerous plastic surgery that we know of today is because of the risk of fat embolism. And so when you get fat in the bloodstream, if that fat goes to the lungs or goes to through the heart, that can cause people to literally die instantly. And the way I describe it, it's like the Death Star. If you watch Star Wars and how the X-Wing fighter goes and throws the missile, shoots the Death Star, that one specific part of the Death Star, the whole thing explodes. And that's the way you got to think about a pulmonary embolism or a fat embolism. It literally people can die within minutes of this operation. Now, I'll tell you, I'm not saying that nobody should have it done, because there are doctors who may dabble in this operation, who really don't have a great idea what's going on, who don't know the anatomy that well. And then there are some plastic surgeons who do this all the time, and because they do it so much, they know how to do it appropriately. Doctors like Dr. Dan Del Vecchio, doctors like Dr. Matthew Schulman, there are real plastic surgeons who may be able to do it fairly safely. But in general, if you're going to consider having fat injected to your buttocks, I would rethink that operation. Make sure that it's worth you really putting your life on the line for this operation. And if you're going to do it, make sure you go to the right doctor. There are doctors, once again, who do this all the time, like Dr. Del Vecchio, Dr. Schulman, Dr. Ashkan Gavami. There's a number of them across the country who are really, really good at it. If you're going to have it done, you want to go to one of them, not to Dr. Joe Schmo down the street, who may do a couple a year. Okay, so, and real quick, the studies that we're finding with this is that even if you don't inject the fat as a plastic surgeon right into the blood vessel, studies are showing actually that if you inject the fat around the blood vessels, okay, in the vicinity, when there is this high tension in the area, because you're injecting so much fat there, that fat can actually go through the tiny micro tears of your veins and become a fat embolism. So even if the doctor has fairly decent technique, there still is that risk there. So would be very, very careful on what you do with that. Now, we've had some questions, so I'm going to go ahead and take a peek here and see if I can bring them up. And I'm not sure that YouTube is going to allow me to do that. Let's see here. Oh, here we go. All right, so Allie asks, can a botched buccal removal be reversed, or buccal fat removal? So what is that? The buccal fat basically are two little fat pockets here and here in your cheeks. And this is an operation I do all the time, where we go on the inside of the mouth to take this little puffy pad of fat out of the inside of your mouth. It's a very simple operation. I've been doing it for the last 15 years. And what it's good for is people who have what I call a bottom heavy or a chubby face. If there's a lot of fullness through here and you want to reduce it, it's a very safe way to reduce and remove that buccal fat. So how do you reverse this operation? The way you reverse it, and I have done that before, is you inject fat basically into that area. Just like I talked to you about how fat grafting into the buttocks can be dangerous, if it's done in the face properly, it's not dangerous. It's a very, very safe operation, and one of my favorite operations to perform. I recently did it on a patient with a very thin face. Her plastic surgeon removed fat from her cheeks doing a buccal fat removal, and it literally made her look like she was sucking on a lollipop, okay, like that. And why he did this on her, I have no idea. But I performed fat grafting to her and actually injected fat into her cheeks to fill them out. And we actually showed the video, the before and the after, and then several weeks, if not several months afterwards, on my YouTube page here. So if you want to take a peek, it was posted maybe a couple of weeks ago, fat grafting to the face, and that was used actually to reverse a buccal fat reduction that probably should have never been done. All right, let me take another peek here at a couple of things. So April, the healing process for buttock surgery is insane as well. Yes, you can't sit on your buttocks for like a month afterwards. You have to use some special pillows to do that. And Jessica White says she just researched Dr. Schulman yesterday. Great job. He's a great doctor, good friend of mine. And if you're going to have BBL, he is definitely one of the guys to go see. Okay, so what other plastic surgery procedures do I recommend that you avoid? A huge one right now, filler injections. Filler injections, I don't recommend you avoid fillers, but I recommend you avoid certain types of fillers. So filler injections are the #2 most popular cosmetic surgery today, after Botox. And basically fillers are, the best way to describe it, it's like synthetic skin. It's like we take skin in a syringe and we can inject it into areas like your nasolabial folds, like into your lips to plump them up. We inject it into the cheeks. We can inject it into the temples. I inject it into the chin, and people have a smaller chin to fill that out. There's a lot of things we can do now with injecting fillers, and they're a very powerful tool that we have, very versatile tool that plastic surgeons and dermatologists have to reshape the face. So why do I recommend you stay away from some of them? Well, the only fillers that I recommend that my patients use are hyaluronic acid fillers, like Restylane products and Juvederm products. And the reason why I recommend only these, Sculptra is another one. Sculptra works very, very differently, so I do think Sculptra is reasonable too. But the reason why I recommend hyaluronic acid fillers only, like Restylane and Juvederm products, is because they are reversible. And it is super important to use a reversible filler. The reason why is that if you use a filler that's non-reversible, well, what if you want to reverse it? Now, some people think, okay, let's say you have your lips done with a non-reversible filler, like with liquid silicone, and you don't like it later. What are you going to do? The only thing you can do basically is cut it out, and that could be a very hazardous situation. I've seen people have fillers injected under their eyes that are permanent, like silicone. Not a good idea. Well, there are other fillers that are not permanent, but they're called semi-permanent. They're made with calcium hydroxyl apatite. Those I do not recommend at all. Same deal. What if you don't like it? What's going to happen? You're screwed. Basically, you have to wait for it to someday dissolve away, or you have to cut it out. There are permanent fillers that are FDA approved, and I disagree with this approval. I think that they're very, very dangerous. So I would definitely recommend that you stay away from anything that's not hyaluronic acid based. And even much scarier than just getting a botched job of filler that you got to fix is if the filler is accidentally injected into a blood vessel. And any plastic surgeon or dermatologist who has done enough injections has seen this, and it's very, very scary. If your doctor has not seen an intravascular injection of a filler, it's probably that doctor just hasn't done enough, or hopefully that doctor is using really, really safe techniques. So what can happen if you accidentally inject a filler into a blood vessel is that whatever that blood vessel is supplying blood supply to can literally die, okay? So if you inject filler into the blood vessels that come up through the nasolabial fold area, those blood vessels will help to supply blood supply to the nose. And there are reports that when that filler is accidentally injected into the nasolabial fold, if you accidentally inject it into the blood vessel there, a branch of the facial artery, you can actually cause parts of the nose to turn black and to die. And people have actually lost parts of their nose from injectable filler that's injected into blood vessels. So that's scary enough. I mean, to be completely deformed after filler is pretty darn scary. But even worse is that when filler is injected in this area or around this area, it's called a danger zone or the danger triangle up here. If that's injected into the wrong blood vessel and it's pushed backwards, then you can actually go blind from that. Yes, believe it or not, filler injected into the face can cause you to go blind. So how do you treat this stuff? You treat it by dissolving that filler away using hyaluronidase, okay? And so hyaluronidase is a liquid substance that I have in my office just in case something bad happens, but your doctor injecting your filler should have that in his or her office, but it can basically dissolve away a hyaluronic acid filler sometimes within minutes, okay? But if you've got a non-hyaluronic acid filler and that's injected into a blood vessel, basically you're screwed. And you've got to just wait and see what happens. There are supportive things that your doctor can do with warm compresses, with nitro paste, hyperbaric oxygen, but there's no way to dissolve a non-hyaluronic acid filler. Okay, so for that reason, if you're going to undergo fillers, only do it with a hyaluronic acid filler or with Sculptra. Sculptra is very dilute, so I don't worry if that's actually accidentally injected into a blood vessel as much. Restylane or Juvederm. Use those products. All right, I had a few more questions before I go to the next cosmetic surgery that I recommend that you all avoid. Let's see, we had a question from DMT 1961. On the tummy tuck you posted yesterday on the 29-year-old, did your tuck make her stomach muscles or were those hers? I don't make stomach muscles. It's not possible to do that. Those were her own stomach muscles. And quite often I see women who are in great shape. They've got great abs, but those abs are covered by a ton of skin. So if you perform a tummy tuck on them, quite often by removing that extra skin, you find that those muscles start to come out, and some patients get a much better contour through there, almost a six-pack type of a look. All right, and I did have another question here, so let me quick answer that before we go to the next operation. Good morning, doctor. This is from Parv J. Good morning, doctor. Love your work. Wish you could relocate. Sometimes I do too, especially in the wintertime. This person is asking about a referral for a surgeon in New York City for a tubular breast correction. So tubular breast correction, there's a lot of great plastic surgeons in New York City. Let me just name a couple of good friends of mine who do great work. Dr. Alexis Hazen. She is the host of Dr. Radio on the Plastic Surgery channel, Dr. Radio. Great plastic surgeon, has a very holistic mindset. So one reason why I love Dr. Hazen is because of her holistic mindset. She's also very active on Instagram. And like I said, I think once a month on Tuesdays, you can hear her show on the Plastic Surgery channel on SiriusXM. A good friend of mine, Dr. Oren Tepper. He's a great plastic surgeon, also in town there. Dr. Arthur Perry, fantastic plastic surgeon in New York City as well. So just a few people. Always recommend seeing more than one plastic surgeon to make sure that you're getting the treatment that you're looking for. And then we mentioned Dr. Matt Schulman earlier, great plastic surgeon too to see. All right, so here we go with the next cosmetic surgery that I recommend that you avoid. Huge news right now, textured breast implants. Now, breast implants come in two different types, smooth-shelled and textured-shelled. The smooth-shelled implants are the ones that I use on all of my patients now. And this is really important because over the last several years, we have discovered that there is a very rare type of cancer associated with textured breast implants. Now, textured breast implants have traditionally been the ones that have been called the gummy bear implants, and they have basically a sandpapery surface to them. And the idea was that this sandpapery surface allowed the implant to stick to the surrounding tissues. Very important, or sometimes very important in women who've had mastectomies and they don't have breast tissue to hold the implant up. And there are some plastic surgeons who find that they were able to get better results, they felt, with a textured breast implant. Well, unfortunately, we are finding that these textured breast implants can induce a lymphoproliferative type of a condition. And we think that the science behind it is that there are bacteria that can live in and around those crevices of those textured breast implants, and they can stimulate the lymphocytes in the scar tissue surrounding them. And by stimulating those lymphocytes, year after year after year, they can induce this lymphoproliferative response where the lymphocytes start to grow and they basically become cancer cells. And this becomes something called ALCL, anaplastic large cell lymphoma. Now, according to the FDA, they have 457 confirmed cases of ALCL related to breast implants here in the United States as of this recording. Some of them, not a large number, but a handful of these patients have actually died from this cancer. So people have actually died from having textured breast implants. That's a huge deal. And as of this recording, they're still on the market today. Some of these implants have been taken off the market in Europe, but they are still available here in the United States. Once I found out about this connection between textured breast implants and ALCL, I stopped using these implants altogether. So I do not use textured breast implants anymore. And luckily, I think, and it's more just how I felt about these all this time is I never liked how they looked or felt anyway. So I put very, very few of these in my patients. And I'm happy about that because ALCL is something that is known. It is scientifically proven to be related to textured breast implants. We don't still know exactly why, it occurs in some people and not others. But this is something that's known. And so if you're thinking about a breast augmentation, I don't use textured breast implants in my patients, and I don't recommend them in general to be used because of those potential risks. So if you think about using textured breast implants, if your plastic surgeon is recommending that to you, you really want to have a good long discussion regarding the safety of these implants and whether that truly is in your best interests. So something to definitely keep in mind. Once again, if you guys have questions, feel free to put a comment on this YouTube video, and I'm happy to answer them on this video if I get them here. All right, so another plastic surgery that I recommend you avoid, one of the worst plastic surgeries, are thread lifts. So let me just give you a bit of a history of the thread lift. So about, 12, maybe up to 15 years ago, suture manufacturers figured out that if you put little barbs on your sutures, so a suture basically, the best way to describe it is it's like fishing wire, okay? It's typically smooth, it's made of some type of a plasticky type of material, or some of them, the absorbable ones, are made of a carbon-based material that can absorb. The original sutures were made of actually real catgut. Well, there are lots of different types of sutures now, and doctors back then, in the day, about 15 years ago, figured out, or not doctors, but suture companies figured out that if you put little barbs on those sutures, that allowed the suture to stick to the tissues better. And so this is something that doctors like myself use all the time. I use a special barb suture when I'm suturing my tummy tucks and my breast reduction surgeries because it allows us to have much less suture material than we used to and to get a nice, good closure. And it helps because it's faster. Well, now after figuring that out, some doctors started trying to use it to lift skin. And they would put these sutures along the jawline here and along the jawline here, and would basically try to lift that skin up by using those barb sutures, because those barbs would catch on the inner tissues and allow tissue then to be lifted. And then they would, let's say, put a knot way up here or in the temple area to try to lift parts of the cheeks and parts of the neck. And you would do this procedure and you would see a video of it, or you would do it and see that it would actually lift those parts of the face up. My bulletproof coffee. And so doctors back 14, 15 years ago were doing these procedures saying, hey, look, we're doing this non-surgical facelift. It takes an hour and there's no downtime with it. How amazing is this? Well, so initially these areas would look lifted, but you give it a month and suddenly they start dropping a bit. 2 months, they drop even more. And a few months later, they're back to where they started. But they weren't technically back to where they started, because even though their skin was still sagging again, now they've got these permanent sutures sticking out of their skin. And like I mentioned to you earlier in this video, permanent things in the face can eventually cause problems. And so I've seen patients all the time after that where I'd have to clip these sutures and try to pull them out and remove them, because literally they'd be there years later. So they were popular for a couple of years, and a lot of non-plastic surgeons were advertising these thread lifts. There was an internist in my area who was advertising this and performing it on her patients, and the results didn't last long at all. And even the best plastic surgeons around the world were getting maybe a 1-year result at best, okay? But those sutures would stay forever. So they died down and plastic surgeons stopped using it, and you didn't really see them afterwards. Well, what's happened since then? Well, unfortunately, plastic surgeons, new generations come along and they forget, or they don't necessarily go back and learn the mistakes of the prior generation. So now thread lifts are back. Now there's a new generation of doctors performing these procedures. They're charging a lot of money for them. And lo and behold, they're saying these are the best things again. The difference, and they are safer now, is that these threads, these barbed threads, are no longer permanent. And so they are absorbable, which I think is a great thing, okay? Because hopefully the worst thing is that you just don't get much of a result from it, or your result lasts 6 to 12 months and then it's probably gone. Worst thing is now you're paying a lot of money for a procedure that really doesn't last all that long, okay? And so because of that reason, I am not a fan of the recurrence of thread lifts. So, you know, like anything, it's so important to see what has come before and not to make those mistakes again. And I saw this with textured breast implants as well. Textured and anatomic breast implants, super popular like 25 years ago, and then another 12 years ago or so, they seem to make a resurgence. I don't think they're going to make a resurgence ever again now because of this ALCL.